Good morning, everybody, and to our political colleagues. We've been joined in a viewing capacity by some of the staff team and some of our elected people on our Health and Welfare Divisional Executive Committee. So they'd be people who work in the health services and who are elected to be the Trade Union Executive Committee and have an active interest in what we're doing here this morning. And as Kevin says, because of the cyber attack, we've gone to a format actually almost by accident that we probably think would have been better to begin with, in that it gives yourselves an opportunity to have a wider reach and serve your interest that way. So when we met in January, we went down through a number of categories of staff where Fórsa were represented in the health and welfare sector. And what we said to you was that we were hoping to get a tool that you could use in your political capacity in terms of if you wanted to know where we were in the health service and who we represented, that you have something that was easy and accessible and that you could see. And we had that tool. We got it yesterday. So you're the first to see it. And we'll give you a very, very quick walk through that. Then we want to talk to you about some of the things that have happened since we last spoke in January. I know all of you weren't at the session, but we want to speak to you about some of the things that have happened since then. And then what I propose to do is to give yourselves room to ask us any questions that you might have for us. But just to kind of say to you, it's a pleasure to be able to do this. And I think it's a good idea outside of the normal Oireachtas sessions, where it's a very formal setting, usually arising from either a crisis or a political parliamentary question or something like that, where we're invited into the Oireachtas on a formal basis. I think it's good to be able to have this kind of open discourse, and we very much welcome that. So Kevin, if you want to just pull up the graphic, what could possibly go wrong, and we'll give you a very, very quick walkthrough what we have for you.
You see that?
Yeah. Yeah. Okay. So we don't need to go through the text of that, but basically what we're basically saying to you, if you look at the heart graphic, you can see that we've broken the heart. We're saying that Fórsa is at the heart of health and welfare, and we've broken the heart chamber into hospitals, community health, corporate, and residential and social. So if we go into that, then you will have a soft copy, and there are hard copies available of a brochure. This is the brochure. We're on the other side of the brochure. Then we've kind of listed out where we are in all of those areas. So, for example, you can see in the hospital sector there the range of grades we have. You know, from audiology, biochemists, etc., physios, all of that stuff that we covered with you the last time. You go into community, and there's some duplication here in that we have categories of staff who would work in community and hospitals, such as physios and podiatrists and psychologists and all that type of thing. And you can see there, we've got contact tracers in now. That's a new established grade because we think we're going to need them for a couple of years to come. You've got your home health coordinators and all of that type of stuff. And then in the corporate end, very much in the news recently with cyber attacks, etc., etc. So you've got civil registrants there, clerical and admin, ICT staff, estate management, and vaccination support officers and all of that type of thing. And then you move over to residential and social, and you will see that that's pretty much largely in the residential care and children and disability care area, and you've got a range of grades there. So what you will be able to see as a reference point in future, now that you have this tool, is that if you wanted to know the breadth of the representation that Fórsa has across the health sector, you can see that at a glance. We're pleased that it's the beauty of this is in its simplicity. We don't have lines and spiders going across to, that you get lost in. So it's there for you. So that's about as much as I need to say about that. That links in also to our own health and welfare website. And you can pick up any information that we're bulleting and so on from that. So having done that, I mean, the idea was to impress upon you when we opened first of all, the first meeting that we had to abandon in December because of the nightmare on Elm Street with ICT. But now we want to impress upon you the vast array of and breadth of the representation that we have across the health sector. So since we met in January, obviously there are a number of things that have happened. Let's start with COVID. So COVID, as you know, hasn't gone away. You don't need me to tell you that. But one of the big developments in COVID since we last spoke in January is the walk-in testing facility, which is fantastic. I've used it twice myself. It gives you a bit of an itchy nose, but hey, it's worth it to know that. But the point about this is that has provided a resource to the citizens of this country that's easy accessible. It's run like clockwork. The queuing times are very, very, very small, even though the take-up has been huge. And it's populated by people in the ambulance service, by some paramedics, but also our clerical and admin people, without question or without even negotiation, put their hands up to volunteer to be relocated in their work streams and go out and man these stations. And I think anybody who's used them will see just how well run they are. The second thing I want to mention is the vaccination rollout program. And I think despite all the doom mongering, and look, I mean, we agreed in January, there were two things that were going to adversely affect the vaccination rollout program. One of them was the supply chain. And the other was if clinical decisions were taken about the suitability of a particular vaccine to a cohort of adults or children for that matter, that would slow things up. But I think anybody who's been vaccinated recently, and again, I'm one of those, I was down in the Helix on Tuesday, to see hundreds and hundreds of people and the throughput and the way it's being run. I was there, including my 15 minutes waiting time to see was I still vertical after the vaccine. I was there for 26 minutes in total. And there were hundreds of people in a very highly populated area. I'm from Finglas, so I went down to the Helix. And it was phenomenal. And again, I'd just like to impress upon you, our people in the clerical and admin stream stood up again without negotiation, again without question, and relocated themselves to go into these places for the greater good. And I think that is commendable. Obviously, in recent times, we've had a cyber attack on the HSE. I presume some of you probably saw on your WhatsApp threads the visual where it showed the HSE security firewall, and it had a picture of a cat with a C and a T and a missing letter. But look, aside from that, it was a very serious incident. What it means for us is we can't even communicate with the people on the other side of the table. We can't communicate with our own members. We have to do everything over the phone. And I'll give you an example. Last night, I gave clearance for our civil registrants to go to the Department of Social Protection and access their software and IT systems so as they can continue to produce marriage certificates required by the law, death certificates required by the law, birth certificates required by the law. So, and really what that means, I suppose, to the public is that if somebody is unfortunate enough to have to lose a loved one, they don't have to worry about a cyber attack inhibiting their ability to be able to have a decent burial with some integrity. That our civil registrants are out there as I speak, making sure that can happen through very unorthodox means. So We also, since we last spoke, there's been the publication of the winter plan, the Sláinte Care implementation strategy, which includes the 96 community health networks. And again, we are very much up for the implementation of the Sláinte Care strategy. The COVID situation seems to have brought about a sharper focus in accelerating the things that need to be done. I see Roisin there, she would know my views on this, that I still think we have a fair distance to travel with consultants, etc. But at least somebody is saying, here's the strategy for implementation. And at least somebody is saying that there is a will to do this, and that what you're going to find is that we are going to be, with the brochure that I showed you and where we're populated, we are going to be at the very, very core of giving a service to people in the community, which will relieve the pressure on the acute hospital system, where people can get the right level of care in the right place at the right time, at little or at low or no cost. The other things that have come about is the sectoral action plan under building momentum for the health sector, which would have been signed off, to be quite honest with you, but for the cyber attack. But I think we're at a stage now, give or take, an issue with hospital consultants, where we have a sectoral action plan, and our cooperation to the rollout of Sláinte Care and a number of performance achievement initiatives will be signed off. The other two things that I wanted to mention briefly to you are our Section 39s and the campaign that we've been running there, and our quest to have a health and social care policy advisor in the Department of Health. And I might ask Catherine to come in on Section 39s and tell you a bit about the campaign that we're running and the document that we've produced on a systemic funding model for Section 39s, 56s, and also Section 10s in the homeless area. So Catherine, I might just bring you in there.
Thanks, Eamon. And if anyone has an eagle eye, they might have noticed just as this session started, I realised I had a full clothes horse of drying clothes on this wet days in the corner. So I manoeuvred. So if you would see me at a weird angle, that's why. I didn't want to distract you with a load of tracksuit bottoms and t-shirts for my son. So apologies for that. It looks very unprofessional. But anyway, I'm angled properly now. Just want to echo all your thanks, or Eamon's thanks and Kevin's thanks for joining us this morning. And I'll be brief on Section 39s because we have written to the Health Committee seeking an audience or an opportunity to present the findings of this report, but I just want to update you as to where we're at. So back when we met, I think in January, we had just concluded a deal in the WRC for pay restoration for the outstanding 250 Section 39s represented by ourselves and other unions through a process were involved in Congress. Part of that, and that was welcomed, and the political support we received in the run-up to that was very welcome, and for those of you who are involved, again, thank you. But part of that agreement said that there would be an element of pay restoration for the second tier of Section 39 organisations commencing this year, and that the employers, the representatives of employers, the HSE and the Department of Health would meet us in the WRC under Anna Perry in the first part of the second quarter, is the language we used, to discuss retrospection. And the reason I'm getting into the detail on this, it's to explain that for those of you who know Section 39 organisations, you'll know what I'm talking about. But just in brief, Section 39 organisations are the organisations funded through the state, but not run by the state. Servants on behalf of the public, but not public servants, who provide services in health and in children's disability and in other areas. So like Enable Ireland, like Child Vision in Drumcondra, and numerous others. So part of the first deal we reached with the employers was for the top 50, they were called to provide 50% of the services to get pay restoration. The deal in December brought the second 50% of employees in line, but didn't answer the question of retrospection. When we went back to the WRC in April, the employer was very, very clear, or the employers, the HSE and the Department of Health, we call them the employers, they obviously just say they're the funders, were very clear that they weren't going to bring in retrospection for those employees. So what they've done now, and they wrote a very stark letter setting out their position last week, So what the offshoot of that is that we now have a 3-tier society for healthcare workers in this country, but they're the same healthcare workers that we're relying on to get us through the pandemic, to get us through the cyber attack, to implement Sláinte Care. But we now have 3 rates of pay. So the issues that I would have flagged back in January are only going to get worse. So the retention of staff in Section 39 organisations, the services to citizens in those who rely on those organisations are going to see a much higher turnover of staff, so they won't have that stability. And, you know, I don't think there's more vulnerable people than our fellow citizens that have to use Section 39 organisations, and for them to always be the poor relation, it's just untenable. It also ties in with Sláinte Care. I mean, Sláinte Care is a universal health system. We're obviously 100% in favour of it, but how you implement that when you have 3 tiers of employee providing services, it doesn't work. It's a contradiction. So as part of, just on that note, and just to keep you in the loop, when I say we now, the Congress of Trade Unions, on behalf of ourselves, SIPTU, and I think the INMO of a few members, but it's mainly Fórsa and SIPTU, have written to Minister Donnelly seeking an urgent meeting on Section 39 funding. There's also a subset of that. There's an ongoing dialogue that was recently set up, the dialogue for the voluntary forum. And we have written to the current minister and the previous minister on numerous occasions seeking access to that, because there's no system for social dialogue for workers in Section 39 organisations. We've been refused access now by both ministers, and that forms part of our recent letter from Congress that we wrote this week. So to kind of bring you up to speed, we're meeting in Congress this afternoon to discuss that element of it. And I suppose from Fórsa's perspective, it's obvious that the solution to the Section 39 problem lies in the political sphere and lies within your hands. So, you know, whether the political solution comes before agitation by the unions or after is out of our hands, but that's unfortunately where we're heading, because these workers just keep getting left behind at a time when more and more has been asked of them, and it's just not sustainable. Which leads me into the Fórsa report that we commissioned. We commissioned an update of our Caring at What Cost report from 2015. Brian Harvey from Maynooth carried that out the latter end of last year and the start of this year. We'll be launching that in July, and that's the report from which we've sought a meeting with the Health Committee. Within that, we've drilled into why Section 39 is failing as the funding model for it, why it doesn't work, and, you know, a better roadmap to a sustainable funding model. And I think, I'm hoping that, you know, we will get to present in front of the Health Committee, and that some, if not all of you, will get to see what we're talking about and what the model we will be talking to you about. And I'm not going to delay today's meeting because we're going to have standalone piece on that. Will actually be just as cost effective as actually outsourcing to Section 39s. I think there's always a fear around pensions when unions mention bringing Section 39 organisations under state control, but actually with the new pension models that are in force for public servants, actually the sums balance out quite nicely. So I would be hoping to get to talk to you again on that matter later in July. So that's kind of where we're at with Section 39. So that's my whistle stop. So thanks, Eamon. I'll hand back to you.
Okay, well, only one other thing before I do a quick wrap up and then open it up to yourselves. Maybe I just want Chris Cully to come in and just give you kind of an overview on why we're so keen to have a health and social care policy advisor in the Department of Health.
Yeah, thanks, Eamon, and thanks everybody for joining the call this morning. And great to see the reception is much better than it was the last day, because there was a few blips the last day. So you're very welcome, and thanks for joining us. Just on the policy advisor, as Eamon said, like, it's key to us that there is a policy advisor for health and social care professionals in the Department of Health, and nurses have a policy advisor. They're a distinct profession in their own right, but so are health and social care professionals. It's actually a group of, I think, 26 different professionals, vast majority of who are regulated or who are scheduled to be regulated by CORU. And it doesn't make sense to us that a key component of the policy development is lacking a key person who's going to be advising on how a model of care looks like, such as sláinte care, and how that implementation might work out. Is a key component that's missing, is somebody representing those professionals at the same level as nursing in the Department of Health for health and social care professionals. So we're keen that happens sooner rather than later. So any influence you can bring to bear on that issue for us would be very, very much welcome. We're key to the rollout of the sláinte care model in the community and primary care. The vast majority of the people delivering those services, taking people away from the pressurised hospital services, as Eamon said earlier, are those people that we represent in the health and social care professional groupings. I don't think there's much more to say, because Eamon had said a lot of it earlier on, and I'm conscious that you all want to get in and have something to say as well.
Okay, well, thanks for that, Chris. So I'm going to wrap up by just breaking it down into three kind of categories of staff, and this is not kind of exhaustive. It might be exhausting, but it's not exhaustive. So the first is, as Chris mentioned, there are health and social care professionals. They are going to be the key cornerstone of delivering the sláinte care model out in the community. And for too long now, they have been an afterthought in the minds of those who plan the services, and they are going to be really required. And that, again, as Chris has said, is why we're looking for a policy advisor in the department. And the second thing is our cohort, much maligned, and I mentioned this before, of administrators and managers. And just to talk about them for a second, I mentioned the last day that we often stand accused of having a bloated health sector, overburdened with administrators, not enough doctors and nurses. They're probably right. There's probably not enough doctors and nurses, but it's not just that. Our administrators are not a burden on the system. In fact, they're a great complement to the system. And the figures I gave you the last day from the census is that our managerial cohort is 1.5% of the overall workforce. Our admin cohort is 10% of the overall workforce. And that includes civil registrants that I've already mentioned, home health coordinators, ICT staff. So to say that we're overburdened with administrators, we simply don't wear that, folks. We just simply don't wear it, and we won't accept it. And that's why it's a kick in the solar plexus for people who've stepped up to be contact tracers, for people who've stepped up to do swabbing and testing, for people who've stepped up to do vaccination, for people who leave their workplaces to go into civil service departments to roll out births, deaths and marriage certificates and all of those type of things. It's a kick in the solar plexus when we hear a narrative on the national media that, well, sure, the solution to the health service is to get rid of administrators. And we're not going to wear it. Simple as that. I think we just want to impress upon you the type of roles that these people play and how valuable they are to our health system. The third cohort we have that I want to mention is our Section 39 people. And we used to have a phrase, certainly in Finglas, maybe it was because of the type of shops we had, yellow pack, right? These are yellow pack workers in the modern day. They are on poor terms and conditions. They have a lack of stability, yet they provide a service directly on behalf of the state. And they provide services that people have as a basic right and entitlement. And I'm talking about disability services, for example. It's people's entitlement to be able to have disability services, yet the people who provide those services directly on behalf of the state are subject to volatile working conditions. And it's time that we stabilise that sector and looked ahead to the future and had a vision to make those part of a systemic funded state model. So I'll leave it at that for now. And maybe if either myself or Kevin could invite any other questions, comments, or things that you want to say to us. There's no strictures and structures around this. You can say we're all adults and we can all say what we think and say what we like. And I'll open it to the floor, perhaps.
Sorry, Shirley, could I ask a question there of Catherine in relation to Section 39 organisations? She was talking about 250 organisations. What kind of numbers of staffing are we talking about that are involved here?
Sorry, I'll just unmute there and apologise because someone's knocking at the door at the same time. I actually couldn't make it up the minute I asked a question. Yeah, I think at the numbers we're talking about from a Fórsa perspective are around 10,000. So then when we look at our colleagues in situ would represent a similar number. So you're talking big numbers, and that's the 250 organisations that are funded solely by the HSE. Go beyond that, and I know this is kind of a little bit beyond what we're talking about this morning. There are also organisations in a similar footing that are funded partly by the HSE, partly by TUSLA, partly by local government when you start drilling into the homeless services. So we wouldn't have the figures on that because this is kind of, we're bringing that into this campaign now. So it goes beyond those 20,000 that I flagged.
And what category of people are you talking about? Are you talking about nurses, care assistants, admin staff?
Yeah, everything. It's an exact mirror in some ways. So if you look at, I often give the example of, say, St. Michael's House and Enable Ireland, who both provide disability services, or the Brothers of Charity. So it's nearly a mirror of that. So within that, you would have, or a mirror of the HSE. So you would have a management team, you would have your nurses, you would have a number of doctors, you would then have all the health and social care professionals, so you would have physios, OTs, SLTs, and that's a huge area where you see huge turnover of staff, because that would be where, and it ties in with assessment and need, which we'll be talking about with children in the next meeting with on disability. But you would be talking about, so all those health and social care professionals, and then underneath that you would have then social care workers, you would have the healthcare assistants, and you would have then a clerical admin support level. So it'd be very similar to what you'd see in community in the HSE.
Just to augment what Catherine has said there as well, like you've got to remember, despite the fact that they kind of have a public sector tag, these companies who provide these services are actually private sector organizations. The difficulty that we've experienced, just so as everybody understands it clearly, is that when the public sector shipped pay cuts under the Haddington Road Agreement and the ones before that, the people in Section 39 agencies also had their pay cut. The problem was when the public servants had their pay restored, the Section 39 people didn't. And that's what's led to the huge disparity in the conditions.
Yeah, but there is a problem in relation to the, the health service, in the sense that there are about 2,500 Section 39 and 38 organisations if you add in the Section 38 organisations. I think the last time I looked at the HSE budget, there's about 4 billion being paid out between all of those organisations, and that's the challenge that we now have as regards how can you bring pay, you know, starting say with the Section 39 organisations, and the, you know, and it is appropriate that they would be paid in the same way as people within the HSE. The question is how you move forward with that, and in a timely manner. And I think that's something that is now going to be a challenge.
You're probably right, and it's probably an ideological challenge as much as anything else. In that the question that needs to be answered is, you know, are we going to continue for the next 20 years to have a model where state services on behalf of the state are provided to people with a basic right to those services on a totally voluntary model that is founded upon a bed of straw? That's really the ideological challenge, I suppose.
And Eamon, if I could just come in just on a practical level, the 2,500 that you're referencing, that we're aware of, that, and a lot of them would be really small organisations. So just on a practical level, I would see a future where there would be shared services, so that not every organisation has its own HR, its own employee relations, its own corporate management, you know, having somebody in each of those organisations having to, say, interpret a HSE circular and put it into some kind of work. And, you know, there is ways that we can streamline it while I suppose spending the 4 billion in a better way. The Section 38s are already costing the exact same because they're full public servants, have the same pension entitlement, same paying conditions. But I think if you were to and don't quote me on this, this is Friday morning in my kitchen thinking, but if you were to look at, say, a Section 38 huge organisation, or a Section 39 like Enable Ireland or Michael's House, and you look at what they do in terms of their corporate systems and the cost for that, would there be an argument that if you drill into the 2,500 where you have organisations with 5 people, 10 people, my own mother runs a community play school up in Kilmore West. It's not Section 39, but it's probably Section 56. She doesn't know what she is. There's 3 of them working there. There's 10 kids in a very deprived area of North Dublin. She has to pay an auditor. She has to get HR advice. And she would, you know, there would be costs associated with that. So if you looked at a different way, I think we have to not just look at converting all Section 39s into public service, because that's too hard. And I think even ideologically, that's such a huge shift. But if you just start going, well, actually, what do they do? Where does their bit of the 4 billion go? If we were to improve their pay and conditions, what can we do differently? So there's not actually costing the state much more. I won't be naive enough to say the exact same, but much more. So I think, you know, there's things like that, and you could have a geographical hub where you would have one of the big players dealing with those parts for the very small Section 39s that make up the kind of the 2,000 that are funded, as I said, a bit from TUSLA, a bit from Hubble, a bit from HSE, a bit from a grant from Dublin City Council. So, you know, that'd be one approach. But I suppose as we need to get into the space, or where we'd like to see it going, is into the space where we have that honest conversation of what do we want as a society, what do we need, Sláinte Carr is the way ahead, what do we need from that, how can we deliver it better? And that's where the unions, and that's where us, particularly in Fórsa, we would be we pride ourselves on taking an open, sensible, listening approach to these things. That, you know, we're not saying we just want conversion in the morning and there'll be no change. There has to be change for that to happen, and you'll find us very willing to discuss that. I'll stop now. It is a bit of a passion of mine. I'm going to stop.
Just to give everyone a chance to come in, I have David, Nessa and Roisin are indicating, so if they had indicated in that order, so I might go to David first, if that's okay. You're on mute there, David, sorry.
Thanks, everybody. Yes, I'm delighted to be on the call, and thanks very much for hosting this event for us, Eamon, and for the information you've sent us on in advance of this session as well. I will promise to do the 30-second video. I'll have it for Monday. I'm getting my hair cut today, so I was waiting until that was done, and I'll send that on as soon as that's finished. I just have a couple of questions, I suppose. I'll make a couple of observations first, but I have a few questions as well. I also want to commend all of your staff for the work that they have done over the last year, in a very difficult year with the pandemic, especially in the whole area of health and social care, all of those professionals, but also those staff that were seconded into contact tracing, into vaccination centres, and the much maligned, as you put it, administrators and managers who also stepped up to the plate as much as anybody else did. So I want to put that on the record from my perspective. Just in relation to a health and social care policy advisor, and obviously that's something that I would support. Why is there a difficulty or a problem or a resistance to that being done? So I'm assuming that you would have lobbied for this. I'm assuming that this is something that is a long-standing demand that you have made. So what's the resistance to it? That's my first question. The whole area of Section 39 workers is obviously complex. So I would agree with Catherine in relation to the challenge it would take and the difficulties it would be to bring all of those fully into the public system. But there are things that we can do. It isn't acceptable that we have 3 different types of pay. It isn't acceptable that we have those issues in relation to those organisations. Analogous workers, I think I've heard them referred to in the past, doing the same work for less pay. So it's simply not acceptable. Or yellow pack workers, as Eamon described them as, or they've been described as. So it's just something that can't be tolerated. So you said you've written to the Health Committee. Most of us, or all of us on this call, are members of the Health Committee. So it is quite difficult at the moment, Eamon, with COVID in relation to us holding meetings. It's beginning to get a bit easier. The Dáil is sitting now 3 days a week. But during the pandemic and for the last number of months, the Health Committee meets once a week for only 2 hours. And we're quite limited in what we can do. And there's a huge amount of work coming at us. But I'm sure the other members of the committee would agree that the whole area of Section 39 workers is something that we could shine a spotlight on, and certainly in the context of the report that Catherine alluded to as well. So I would support that. And I just have a question as well in relation to, one, the number of health and social care professionals that are in the system, and also the numbers that you guys represent. And my last question is in relation to public health departments. So obviously that's an area now that has come into sharp focus. It was also seen as a poor relation, and I'm talking about medical scientists, lab technicians, and all of that area. But you made the point, Damon, that we're going to have to see some sort of permanent contact tracing systems in place, and I would agree with that. I think that would be a focus. Are you guys organising in that area? And if you are, how would you see that working out in the medium to long term as well? And just to finish as well, again, to commend all of your staff for the huge work that they've done over the last 12 to 14 months.
Okay, thanks, David. So just on the Section 39, we only wrote to the Oireachtas clerk yesterday. So, and in fairness, we got a response, and we hope to see you soon enough, and we can take that up there, because I think when you see the document that we presented to you, it will raise a number of questions for you. I think you'll find it useful. On the Health and Social Care Policy Advisor in the Department of Health, we have made some traction on the basis that there is an agreement in principle to have one. However, the difficulty lies in a decision that the department unilaterally took to fit that into the reporting stream to nursing. And quite frankly, that's not where our people see themselves as residing. What our people are saying is that if we are going to be centerpieces in the delivery of sláinte care, well, then we need somebody to advocate for our professions within the department as a separate stream. And I think there's an acknowledgement in the department. They know that that's what we want. There's probably a complication, without getting into too much detail, where the person who's the chief nursing officer has a dual role. But I think that's up for negotiation, and we will be looking to meet Robert Watt now that he's been appointed to have that conversation. But if that conversation doesn't produce something for us, we would certainly be campaigning actively to achieve what we're saying. So that's where that is, David. The third issue about the health and social care professionals, I mean, we probably represent, directly, upwards of 10,000 of these people, but there's up to 30,000 of them in the system. There's a significant tranche. I know what you said about medical scientists and lab people. Those people, all of this stuff that you get from the results of your test, your COVID test, all of the data that Tony Holohan and Ronan Glynn relied on every day of the week for the last 16 months, they were all produced by our people in surveillance science in the Health Protection Surveillance Centre. So again, they are unsung heroes. Are we going to organise in contact tracing? Absolutely. We would see that ourselves and SIP2 would have a shared kind of organisation profile in both testing and tracing and vaccination rollout, depending on which professionals we respectively represent. So yes, I think it's an area that we need to understand that we are probably going to be facing vaccination for quite a period of time, whether that's one shot a year or one shot every 2 years or whatever. But I think one thing it has taught us that we are open to threat from viruses and variants, and that contact tracing is going to be a systemic part of the future,
Okay, thanks very much for that. We have Nessa, Roisin, and then Annie indicating in that order, and then I come to yourself, Lorraine, as well, if that's all right.
Thanks, Kevin. Well, look, thanks for the session this morning in general, and I really agree with Eamon. Like we're going to be dealing with this and for forever. I would think that it's just a new reality that we're going to have. But it's really useful, actually. Even the graphic this morning, I know, like doing that kind of work actually helps organize everybody's thinking, and so actually can be very, very helpful. And like David, I'll do the video, but not today because I got caught in the rain bringing the kids to school, so I'm a bit of a mess. Just to say, look, I suppose it's been such a challenging year for everyone across the health service, and for me anyway, it's reiterated that when you're talking about keeping things going in a tough time, the recognition is that everyone is vital, from the porter up, to the clerical officer and beyond. And I think that's why it's just like having a meaningful discussion around the Section 39 stuff would be very important and timely, and I'd be supporting that at the Health Committee. And obviously the work programme is constrained at the moment, like David said, but I think we have to find a space for that. I think we are at a really kind of strange moment right now, in that we're dealing with the last year and also with the current hack and the vaccination rollout and quarantine and testing. And then I'm also mindful, though, that we're kind of setting ourselves up for the next few years also. So, the impact of like the waiting lists increasing, and, are we going to see long COVID and the fallout from delayed treatment? So I guess the kind of things that are on the horizon would be that holding on to the increase in funds and holding on to that sense that the health service is like an inter and multidisciplinary team with many skills, and they're all important, and then putting the stuff in place for sláinte care, and that idea of the community care and the corporate and the residential and social, and reorganizing teams in a cross-disciplinary way. And I think that's going to have to be done really, really carefully. And I take Eamon's point, actually. I think that's a really core issue, that like the corporate staff are going to be so important, because once you kind of decentralize services, it becomes about like getting the right service to the right person, and therefore it's like logistics. And so those kind of corporate services and clerical staff become incredibly important. So look, I actually had a question about your plans for kind of the permanent services that we'll see post-COVID in terms of labs and tracing, but you already covered it. So just thanks for this morning.
Thanks. And what I'd say to you, which is just something that you mentioned about waiting lists there. You see, one thing that COVID has taught me, right, is that our workforce actually gets the fact that they're working for a health public service, that they're not just working for Acme Health Limited, and the efforts they've made show that. So without exploiting the workforce, I think there's a trick to find the balance in the type of things we can do when we mobilize and capture that. For example, cancer diagnostics, way behind now because of COVID. So when we're clear of COVID, or when we have COVID in order, let's call it, that's a better way of putting it, right? There's going to have to be a redoubling of efforts across all professions and clerical, and to get cancer diagnostics and treatment back on track, And I'd like to think that some of the esprit de corps, if you want to call it, that we showed in getting COVID under control, and the cyber attack under control, and the vaccination rollout and all of that, that we can now say our immediate crisis now is getting whatever cancer diagnostics and other diagnostics back on track. And I'd like to think that we could get involved in that. I think that's important as we look forward,
Okay, thanks very much for that. Roisin, you're up next yourself.
Thanks very much, and thanks for this morning's session. But I also want to very warmly welcome this initiative, because I think it's absolutely critical to levelling the playing pitch, as it were, within the health sector. I mean, the old way of thinking about health was that doctors delivered health services. And, increasingly now people are realising that there are a whole lot of different critical players in that, including yourselves. And, again, traditionally, the muscle was on the part of doctors. And the stronger voices. So it's really important that we're hearing the voices right across the health service, because all of the different elements are equally important. And if anything, I would say health and social care professionals are absolutely vital in the rollout of sláinte care as we move to a community-based model of care, and also addressing illness at the lowest level of complexity. All of those things that we say about sláinte care, health and social care professionals are in particular absolutely critical to that. And part of that, I think, is the request for a policy advisor. I have to say, today is the first time I've heard of that request, and it makes absolute sense. I was involved at the time when the chief nursing officer was appointed. And again, it's part of that thing of ensuring the voice is heard at the highest level within the department. And, you know, the chief nursing officer is now up there with senior management in the department. And that's why I think it absolutely makes sense that there's a policy advisor also in relation to health and social care community generally. So I think the committee should try and put its weight behind that request and pursue it. I'm also glad to hear that the request has gone in on the Section 39s. I was thinking to myself when Catherine was talking, I hadn't heard about that, but you said it only went in yesterday. So we have our own private meeting on a Tuesday, and that'll come up next week, and that's where we decide on the work programme. So, you know, I think most of us would be very supportive of having you in soon. Catherine, you mentioned about the 2 ministers and in the WRC. Is that deeper and health, or is it deeper in finance?
Sorry,
sorry, you did refer to 2 ministers. So I was wondering who they were. If I could just bank that for 1 second. Just other questions specifically on staffing. The contact tracers, I never heard how many of those are permanent staff and how many are contract staff and temporary contract staff. And maybe you just fill us in on that. And I think there will certainly be a demand on an ongoing basis.
Roisin, I'll answer that straight away for you. They are on 18-month contracts. They were recruited through an agency.
All of them.
Well, now, some of our people who are substantively permanent moved into those posts to get it up and running. And they have substantive permanent posts to go to. But the bulk of those, and there's up to 1,000 of them, the bulk of those are on 18-month contracts.
Okay, so I related to that, I was going to ask how many staff are currently redeployed into COVID-specific areas and the implications of that for their core work. And my last question just is in relation to the 7,000 community staff that have been promised under Sláinte Care over the next 3 years. What's your view about that, and how many of those will be coming into your domain? And do you foresee any difficulties in recruiting that number of additional staff? So thanks for that.
Okay, well, I'll answer the last question first because it's freshest on my mind. A significant part of that would be 1,500 health and social care professionals, 700 of which are being done this year, and it's doable. And then the other 800 in 2022. So the main people who will be coming into our constituency, I mean, there might be occasional recruitment of admin support and so on, but the bulk of it will be in health and social care professionals. And to be fair, that's where it's needed. I think that is a target that's achievable. The other question on your contact tracers, you asked.
Well, just how many of those would you see staying on a long-term basis?
Oh, sorry. The other question was, how many people had redeployed internally? Yeah. So that's kind of a movable feast because in March of 2020. We set aside all of the redeployment protections under the National Pay Agreement, and we allowed for immediate reassignment due to COVID. So literally thousands is the answer at that point in time. But remember, at that stage, Roisin, primary care was all but shut down, and many other health services were shut down. So the figure in March of April, and people went into private nursing homes, and to help out that sector as well. So there were thousands upon thousands. But since the establishment of swabbing and testing as a functionality and contact tracing as a functionality, many of those have returned to their substantive posts in the likes of primary care and out in the community healthcare organisations. So you're probably talking in the low 1,000 bracket at this stage, kind of maybe 1,000 people, but that's not taking into account vaccination. So I don't have hard figures, but what I can say to you is, when it's needed, it happens.
Okay, I mean, it showed incredible flexibility right across the board last year.
Okay, thanks very much for that, Annie, and then Lorraine.
Evan, just before you move on, I have to answer a question for Rosie.
Sorry, Catherine, you're right. Yeah, pardon me.
I have my notes in front of me. And just on the redeployment piece, Eamon, did you the fact that we agreed again? We probably did mention it. That is part of the response to the cyber attack. That's another time when the HSE immediately came knocking on Fórsa's door, going, "We need to redeploy some of your people to make sure people get paid, to make sure services continue." So, you know, I know we keep saying we're at the heart of it, but we really are. Sorry, Rosie. In response to your question, there was I know I mentioned a number of ministers. So, in terms of our access to the newly established or the recently established dialogue forum for voluntary bodies to be a voice for Section 39 workers, we've written to the current Minister for Health and the previous Minister for Health on a number of occasions. In the WRC in December, and throughout that process running up to it, we would have had the Department of Health and the HSE in the room as the funders, so that would have been the Minister for Health involved there. But where the Minister for Public Expenditure and Reform came in was we kept getting told the answer is no because of DEEPR. So we then wrote to Minister McGrath again before Christmas looking for a meet. And when I say we, this was Congress on behalf of ourselves and SIP2 and the other unions involved. So that's where that minister became involved. Does that make sense?
Okay, thanks very much. Annie?
Hi everyone, I hope you can hear me all right. Sometimes I have to hold this microphone up to my mouth so people can hear me. Thank you so much for this presentation, and I really have to commend you. You know, the graphic is fantastic. It's really eye-opening for myself to see how the breadth, I suppose, of healthcare professionals that you cover. Actually really useful for myself because, you know, you grow up thinking of healthcare professionals being doctors, nurses, and then that's it. And then, you know, there's a whole other world there. So I think this is extremely useful, actually, even for just generally to give people a real understanding of actually there is an enormous cohort of people who are health professionals, who are keeping our health system going. And I suppose that sometimes I maybe even puts a challenge to ourselves as public reps, that when we're talking about health professionals, that we are much more broad in as how we talk about it and our language and who we are including in that, and not just going down to maybe a base level, if you will, of what we think people traditionally think of. So I think it's really fantastic. I've been clicking away here on the website and looking at it, and it's really fantastic. And I suppose when you come kind of later on, you end up echoing what's already been said. I mean, I very much will be in support of this, you know, having a conversation at the Health Committee around the Section 39. It's an area that I think we just need to get to grips with, and there needs to be a bit more stronger political leadership on that. So I'll be certainly supporting getting that added to the work plan and done so promptly. In the Health and Social Care Policy Advisor, I suppose I also, this is the first time I've heard of something like this, and it obviously just makes sense. I think an awful lot of sometimes when people suggest things, it's suddenly very obvious. Actually, why isn't this there? Why doesn't that there? Like, what do you think is the likelihood of that actually happening? Do you know what I mean? Like, there was, as I said, success before with the nursing advisor and stuff like that. So do you think there's a possibility of success in that, or how do you think that's going to go? And then I was wondering, Eamon, if you'd be able to expand a little bit. You were talking about the role you see your members being involved in the rollout of, you know, you've talked about cancer diagnostic, for example, and how to try and resolve the backlog that we kind of are going to have. Maybe just expand a little bit more on actually where you see that role. You know, I think that could be really useful for us then, as you said, most of us are on the Health Committee, you know, in terms of being able to go forward and supporting those ideas or suggestions.
Okay, just on the health and the HSCP policy advisor, I'll give you two answers to that, Annie. I can give you a trade union answer, and I can give you an answer in this forum. So, do I think it will happen? The trade union answer is we'll make sure it does, right? And you can decode that whatever way you want, because we won't stop. The other answer is that I think there is the basis for it happening on the basis of what we've heard so far, but we've really got to get it over the line. So that's where that resides, right? The second thing about backlogs in cancer diagnostics, it has just struck me, and this is something that we've been just tossing around among the staff team here. It has just struck me that more than ever, when you see the response to COVID and all of the byproducts of COVID, that we have a workforce, as I said earlier, who gets the fact that they're working in a public health service. And I'm very proud of that, right? And when they're valued and when they see what they're doing is regarded as meaningful, and it's not just, you see, sometimes people go to work and they do a number of processes and they never quite understand that that's all part of a chain of things that deliver an outcome. But it's never been more visible than in, say, a vaccination rollout program or contact tracing and all of that. And I think if we could approach the health sector in that way, I think we could tap into the flexibilities and the willingness that people have shown, right, by valuing them more, right? And not, it must be terrible to be a TUSLA member of staff, for example, and every time there's a childcare crisis, to hear that TUSLA is a disgrace. What's it like going to work for that organization? And that nothing could be further from the truth, right? Equally, when you're a healthcare worker in, say, an administrator, and you're told on the radio by the people, some of whom you elect, or some of whom run the organization that you work for, that we're overburdened with administrators, that is not going to generate a flexibility that's going to meet the requirement to galvanize ourselves and catch up on all that we've missed in very important services, life and death services for people. But I think if we start valuing people and if we start capturing what we've been able to do in a mobilized way, I think we can get to a place where we could be very, very much on the front foot in terms of catching up on what we've missed. That's the answer to your question, you know.
That's great. Thanks very much. And last but by no means least, Lorraine, if you want to join us there.
Thanks a million, and let me guarantee you, Catherine, I have a clothes horse here in the corner as well, full of stocking kids' clothes that'll have to get dried before the weekend. But look, I'd like to thank you all for your excellent presentations and this really, really useful conversation with colleagues from the Health Committee. And, you know, I'd like to take this opportunity to thank your members for stepping up to the enormous challenge over the past 15 or so months. It's been a tremendous effort. And Eamon, as you've pointed out as well, they did so without complaining or causing any obstruction. They just did what was required, and we all very much appreciate the effort that they've gone to over the past months. I suppose the whole COVID crisis has given us an opportunity to discuss the concept of care and the value we place on care in society and how we care for the people that care for us and got us through this enormous crisis. And I, for one, am very, very happy to see that. We've seen early years education providers stepping up to the challenge. We've seen people, like you've mentioned, contact tracers on short contracts, but doing such valuable work, and the speed and the efficiency of the pop-up test centres, of the vaccination centres, really are a sight to behold. And, you know, in a country where we sometimes complain a lot about services provided to the public, I think nobody can have a complaint about any of those absolutely vital services. You know, and joined in the conversation about carers and how we care for people in the provision of care. We have to bear in mind that we're the youngest and fastest growing population in Europe, and we are also having like a longer life expectancy. So all of that combined, hopefully we can have a good and wide-reaching conversation on the value that we place on care in society and the people involved in that care. And like the other members here, I very much support the Section 39 conversation being had at the Health Committee, and we look forward to progressing that onto the agenda as things get a little bit more. We might be able to have longer meetings than the 2-hour meetings that we're constrained to at the moment. Hopefully we can get it onto the work agenda. And look, I look forward to engaging with you all over the coming months. And thank you very much for the work you've put into the graphic. Like Annie said, it's very, very useful for people like myself to see the absolute wide breadth of people involved in our health service and involved in giving us care and getting us through this crisis and other crises. And once this is under control. Like you said, Eamon, there, that we're going to have very many challenges in relation to the cancer care, mental health services. You know, I'm dealing with parents whose kids have missed out in speech and language therapies and psychological assessments and various things over the past 15 months. So they're the challenges, and I am in no doubt of the ability of the Fórsa members to step up to those challenges again. So well done, and thanks very much for your time and effort today.
Okay. Could I just say one final thing? So when all those pubs and restaurants open up in the coming weeks, you know, our members, environmental health officers, will be there making sure that your food is safe for you to eat as well. So just wanted to say that to you.
Okay. Thanks, Chris. And I just want to close by thanking Kevin for doing all of the legwork on this in terms of bringing it together and using his remarkable skill to bring this together. But just to make a general comment, this has been a learning exercise for us, because we assumed that there were always barriers between us and the political system. Actually, it turns out that we all recognize that we've different roles and different jobs to do, and we're allowed to disagree with each other. We're even allowed to have the odd row here and there. That's okay. But we're all serving the public in various ways, you know. I'm just delighted that I'm after seeing that actually those barriers aren't really barriers at all. So it's great to have a kind of an open conversation with yourselves. And I really, really do appreciate, on behalf of the team here, of you taking the time to have the dialogue with us. I said, I think this type of informal dialogue, at least as a brainstorming exercise, is good. And maybe we should, every few months, we should rock up and do it, you know, and I very much welcome that. I don't want it to be a draw on you. I'd like to think that we can bring something to the party, excuse the pun, or parties. And look, you know, and we're acutely keen to hear what you have to say as our elected representatives, and, you know, representing our own community, what you have to say. And just to thank you for coming this morning. And I think it's been a worthwhile experience. So thanks.
Thanks very much, folks. Talk to you again soon.
All right. Bye-bye now.
Thank you.